Welcome to SCR Connections. Thank you everyone for joining us. It is my pleasure to introduce our guest speakers, Jessica Rangel and Diane Connery. Jessica is the Senior Vice President of Clinical Innovation at the University of North Texas Health Science Center at Fort Worth, with over 33 years experience as a clinician and executive patient safety officer. As a distinguished fellow of the National Academies of Practice, she fosters an interprofessional ecosystem of experiential lifelong learning. Diane is the Special Projects Librarian of the innovative Pottsboro Public Library. She was a corporate trainer and entrepreneur before moving to a rural community 10 years ago. On the verge of closing its doors, Diane led a group of dedicated volunteers who transformed it into the vibrant community gathering place it is today. She is passionate about the role of rural libraries. In today's SCR Connection, Jessica and Diane will give a presentation on telehealth and rural public libraries. Thank you, Senior Vice President Rangel and Diane, for being our guest speakers this morning, and I will turn everything over to you.
All right. Let's see. Thank you so much, Edward. All right. Are you seeing my slide? I hope so. Okay. I will say that this today feels luxurious. Jessica and I have done an abbreviated version of this, I think twice now. And so today we have more time, so we'll be able to go in to some more specifics, which I'm looking forward to. And as Edward mentioned, please type any questions into the chat if there's something that we don't cover. So my name's Diane Connery. I'm going to start this off and then turn it over to Jessica as we go. So first of all, maybe this is a crowd who knows about telehealth. So what is it? It is connecting with video to healthcare providers in this case. And what you're looking at is the telehealth room here in Pottsboro, in our little rural library. Our library was basically one room, about a little less than 3,000 square feet. The room I'm in 6 months ago was a storage closet that was just full of, old books and things we didn't need. And so I'll talk about how we came to be in this place, tell you how I am right now sitting in our telehealth room. So you'll see we have a keyboard with really visible letters, keys on them. And the lighting, I think, is one of the things that people notice the most. And through research, what we have found is that lighting is very important to good telehealth visits. And I will say that a lot of my initial information came from looking at the Veterans Administration. It has a program called Atlas, and it is in really remote areas for veterans to be able to access health care, out in the middle of the wilderness in Montana, that kind of thing. So I have a good webcam on the monitor, speakers, a pen, paper for people to write down notes as they're having appointments, and a mirror as well. And then you'll see to the side there, we've got some equipment, blood pressure cuffs, pulse oximeters, thermometer, gloves, a scale. So some basic things that some people might need to have access to those numbers when they have an appointment. So Jessica is in Fort Worth, about an hour and a half, I think, depending on traffic, from me in Pottsboro. So this has been just a huge learning curve, and we want to be able to share with all of you what we're learning. So why libraries? Why rural libraries. And just to tell you a little bit about Pottsboro is a town, well, there are 2,500 people in city limits, and altogether in the zip code, there's about 7,000. We're an hour and a half north of Dallas, and I tell people sometimes it is like driving back in time, but not in a quaint way. Some little towns are quaint. Pottsboro's not really. We're on a lake. People buy weekend homes here, lake homes, and then a lot of those people go on to retire here. And most of those people are outside city limits by the lake, but then inside city limits, there's a very small tax base. There is virtually no public transportation. Once in a while, there's transportation for older people to get to medical appointments. But we don't have, other than that, public transportation. Ride share is not a thing here. And it so happens that the library is in a part of town that we have several, well, 3 different housing authority or low income housing apartment complexes. And a surprising to me, number of those people do not have transportation. So they are really limited in the service they got. So internet access is a real struggle in our town. Some of it is affordability, but a lot of it is just that the infrastructure does not exist in Pottsboro. It makes sense to me now that, you know, the big providers, their return on investment, if they put up towers out here, is just not nearly what it would be in more urban areas. So they haven't bothered to do that. So there are definite patches around town that the only option for internet is satellite. And, you know, if it's raining or windy, that doesn't work so well. It's slow, it's expensive. If you want to do any sort of streaming, it's just not sufficient in a lot of cases. So the library is also working on the side on that. And, you know, you all are hearing about the infrastructure funding that's coming. So I think all of this goes together, the infrastructure, the internet, and telehealth. And so because people had such a lack of access to internet when the pandemic started, we as a library have stayed open throughout because we knew people didn't have access to the internet at home. And so we did a variety of things. We put up hotspots all around town for people to get to. We put up Wi-Fi hotspots in our parking lot, but then we stayed open because people needed to fax and print. I guess one of the most sobering things when the pandemic started, people were coming in to fax end-of-life documents and, you know, wills and that kind of thing, because nobody knew where this was going. So we have stayed open to provide internet access to people. And so we started getting people who came in and said their doctor wanted to have an appointment with them, but did not want them to risk coming into the office. And one example is one of our regular patrons has COPD. And shortly before all of the shutdown started, she had been diagnosed with some sort of brain tumor, but they didn't know the specifics of it. So the neurologist wanted to have an appointment with her to talk about it, but she was too high risk to bring in. And so she called the library, asked if she could come in, which she did. And then I put her in my office, which was the only private space in the library, so she could have some privacy. And then we had several more just one-offs. Somebody who had their 4-week C-section follow-up. There was dermatology, a veteran who needed to get a refill on some medicine. So in our, and also about this time, I was taking at library school at TWU, I was taking a consumer health information class, which allowed me, for one of my assignments, to look at all the demographics and the uninsured rate and health literacy, that kind of thing. And it just became clear it was a real need. And our library, we're not a traditional library. We do a lot of things that relate to technology. And then also, for example, we have a library of things where we check out non-traditional items like cargo bicycles and canning supplies and tools and wheelchairs, so some durable medical equipment. So we have those sorts of things. And I just want to say, when I'm talking about connectivity, to paint the picture for you, I was talking to the president of our local emergency services, and she told me something I had never realized. She said, not only do a lot of the people outside of city limits not have a landline nor a cell phone plan with a data plan, a cell phone with a data plan, but they have old cell phones that if you keep them charged, you can only call 911 with them. And so she said they get quite a few calls calling the fire department or emergency services to come. They've fallen and they need help getting up, that kind of thing. So all these things just kind of came together at the same time to say there is a real need for this service in our community. And through a wonderfully timed, it was a COVID outreach grant through the National or Network of National Library of Medicine, the South Central region. We were granted $20,000 to launch a pilot program. And I do want to say at this point, this is scalable to any size library. I tend to like to do things big. So we have a whole room here, and our library facilitated that. It lent itself to that because we have an outdoor, a door directly to the outdoors, and has a wheelchair ramp out there. It so happens that the HVAC doesn't even, there's no ductwork that is cross-ventilating the building. So we got our own dedicated little mini split, they call it. So it's self-contained in here. And so through this National Library Medicine grant with the $20,000, we were able to fund the lighting and the computers, and I'm taking some CHIS certification classes, working on my level 2. And it makes so much sense to me because libraries are information professionals. So there's other things that I have done, like on all the public computers, there are Medline Plus icons on the desktops. The Health Science Center has provided a number of handouts on things like health literacy that are available to people. And I'm also, I've started giving community education classes. Last week, we had an emergency preparedness. You all remember the winter storm. So like, hey, what did you learn? How did you hack the catastrophe? What can we do better next time to be more prepared? So we're having those sorts of community conversations. Next week, I'm doing how to make your house a smart home. I'm really working on a whole series about aging in place because we do have a population here that's older than most other areas. So how does it work? Here's a wonderful thing, speaking as a librarian in an understaffed, underfunded library. Through National Library of Medicine, we were connected with the great people at the Health Science Center who have just been great partners to get all this going. And what that looks like is their marketing people came up with great materials for me. We have had, I can't even count now, how many phone calls, Zoom meetings with multiple different teams there. When I started talking to other libraries about it, the pushback I got from other libraries was, we do not want to be inviting people to come to the library who might be contagious. Of course, you know, COVID was on everybody's mind. Well, After talking to Safer Care Texas, the disinfection protocol, we have like a 4-page protocol. They provided gallons of this disinfecting solution and a whole process of how we clean in between appointments. On the right photo there, you can see it's a standalone HEPA filter under the white desk, and there's 15 minutes in between participants. And what I really appreciate about this is people call the Health Science Center to schedule an appointment, and all the screening and all the payment is done on their end. I only get an email the day before saying, without even a name, saying you will have an appointment at 3 o'clock tomorrow. So I am able to help people come in, get logged in, provide as much technical help as they need, and then I can leave them alone to have their private appointment. Just as an aside, when you look at this room, you'll see 2 people can fit in here, which is a benefit. So that's one thing I learned from the Veterans Administration and the Atlas program. There is also, because people need to fill out some paperwork in advance, we have an outdoor iPad kiosk that if someone has not been able to fill out paperwork in advance of their appointment, they can come early and then complete that on the iPad outside. So, you know, in every area, I was going to say a rural area, but people have a variety of different situations. Some people have smartphones, some people have nothing. So we're able to be really flexible in terms of what people need to make this work for them. And right now we're doing this through the grant. We're doing this 2 days a week. It's Tuesdays and Fridays that people can come for these appointments. Other days of the week, we can do the one-off appointments like we were doing before when people want to connect. They have their own healthcare provider they want to connect with. And as an aside, we're now in talks with some behavioral health people, because in talking to the school district, they said counseling is a real need that some of their students have. So this is the marketing information on the left. I mentioned, and we mailed this out to everyone in our zip code. I have hand delivered them door to door in apartment complexes. We have stacks of them at the local pharmacy. Everybody at school, all the students took them home. Meals on Wheels were given this information. WIC. And we have no newspaper in our town, and the TV station is about 30 minutes away. So getting the word out for us in a rural community has been a real struggle, as it often is. A lot of this is just word of mouth, but you see on the right-hand side there, that's the digital sign in front of City Hall. So we just put up this, need a doctor, connect online, Pottsboro Library. But we're still in such early stages of this. Like even when we say telehealth to somebody, if they don't have a smartphone, they don't have internet at home, do they even have any idea of what telehealth looks like? So it is a learning experience, and we're working through this together. So I'm going to turn it over to Jessica now to jump in here.
Well, thank you, Diane, and thank you everyone for the opportunity to share this. And I think Diane and our hope is that you all will be stimulated into thinking about your contribution to how we can make it better for others in these rural communities. Because we had a lot of surprises along the journey. And as Diane said in another talk, and I love it, we were flying the airplane as we were building it. And we did it, and with a lot of people's help. And I want to acknowledge one of my colleagues, Vice Provost Dan Burgard, who it was really instrumental, along with Brian Leaf, in making this connection happen because he saw the potential in what would have been an unlikely relationship. And it's thinking out of the box and innovation that's making a difference in reaching people. So I want to share a little bit about our journey, but as we go through this journey, I hope your big take home will be this, and that is that broadband is a social determinant of health, and not just physical health, but mental, behavioral health, companionship. There's lots of things that if we want individuals to, especially our youth, to be successful in rural communities, we've got a lot of work to do. And so let me share a little bit about our journey. So in this slide, we're rethinking how we reach people, and just what exacerbates the problem, and specifically in Texas, is that we have had, and I think we are the leading in the nation, of rural community hospitals that are closing. So for many, that was the only healthcare access available. In fact, I encourage you to create a map, look at the state of Texas and see where there are actually primary care physicians and where there are not. And you will see tremendous gaps in access to healthcare. And typically those are communities without broadband access, unless you have a Diane in your community who can help create that through the library, which is frankly the epicenter of life through the library. So it's been unprecedented in Texas. And to further exacerbate that, and this goes to a slide, well, our next point, which is about first world views misaligned. People said to us in the beginning, yeah, but there's a hospital 45 minutes away. Well, not understanding that a lot of folks just don't have reliable transportation, if they have transportation at all. And so, in fact, as we move towards even aging in place, as Diane mentioned, and there's a rather large retirement community in Pottsboro, we don't want folks to have to leave if they don't want to. How beautiful to just be able to take care of what you need locally in the library. You walk down the street and you're there. So we had to rethink that. To expand a little bit about that first world view, it's so easy to also forget that even in our own urban backyards, we have disparate communities just like this. It is a false assumption to think everybody has a smartphone. It is absolutely not true. And to Diane's point earlier, many of the repurposed phones are simply to call 911, and that's people's only access. So when we tried to communicate what was going to happen at the library, a QR code does not cut it. A QR code meaning you use your smartphone, you use the photo app, and it downloads access to whatever. Many individuals don't even know what a QR code is. So we have to think about how what we're providing is being received and how we communicate that. So from others' views, we determined we really need to create a poster that if you do have a smartphone, this is how you work a QR code to access whatever it is, healthcare or access in general. So to that end, we talk about technology inequities in the rural communities. So when I visited Pottsboro, and it really was a learner's curve for me, I wanted Diane to share with me what is the community? Tell me all about it, what's going on. And one section in the Pottsboro library that is absolutely fascinating is that they have a gaming section. And Diane taught me so beautifully that truly digital literacy, especially for our youth, is social currency. And I really think that was a beautiful statement. We have to think about that. But I also want you to think about many of our elderly aging in place with maybe just a little bit of cognitive decline. Oftentimes we ask them to get on a computer and fill out these forms and click here and do that. And it's really not helpful, quite frankly, because we have digital literacy issues. Going back to our youth, that's a great service that Pottsboro provides, is that gaming opportunity, because many of this youth want to go on to college. And how disparate would it be to send a young person to college and they don't even know how to operate a computer well. That truly in our current society, it just doesn't work. And so when we think about the technology inequities, it is really time that we address that piece as well when we go to these rural communities, allowing people to have access, and then somebody like a Diane or assistant to help them navigate the digital requirements for accessing healthcare or even to gain. What a beautiful way to help people get up to speed in that. And so we had to think about, how do we advertise what we're offering? And so it's not enough just to do a television station and do a TV spot on what we're doing. To Diane's point, people don't have smartphones, so that means they don't have social media. And we know social media is truly a way where things spread like wildfire. But if social media access is not even an opportunity to advertise what's going on, we have to rethink how we do what we do. So we sent out mailers to people. That is something that I think is really important. On the Pottsboro sign or the community sign, if there's a digital sign, exactly what Diane shared, you want to see a doctor, as opposed to saying telehealth, which many people aren't sure what exactly that means. So rethinking how you spread the word is so important. And in fact, reaching out to a lot of those community leaders who can translate for others. Hey, in the future, if you feel like, you don't feel well, here's what you could do. So word of mouth is certainly important as well, but just being present, physically present in those communities. And we create flyers for them. We are working very diligently to visit Diane on a pretty regular basis to see what can we do to service further. What else can we do? How can we serve the community? And a lot of that goes back to relying on printed materials, which I know during COVID has been a big no-no in many respects, but at the same time, we're working through all that. So the next slide, please. So the other thing we had to think about, technology, of course, but we had to think about training clinicians. So I'll share with you, I think it's a false assumption to assume that just because I'm a great clinician at the bedside, that I can provide that same quality service through a camera. So for example, think about this. Diane's got some great light on her because we took special time to determine what lights would be best. But if I don't even have proper lighting to view my patient, to me, Diane could look very pale, or she could look sallow. It could give me a lot of visual information that's incorrect just because the lighting is more yellow than it is white. So all of that is to say that when we're training our clinicians, we need to take some of our experienced veteran clinicians and help them understand how to convert their visual assessments through the computer versus in person. So another example is like as we look at Diane, I keep using you, Diane, as my my patient. But as I look at Diane, I can't see what her hands are doing. But if Diane was my patient in person, I could see that maybe she was wringing her hands because she was really nervous. Or again, those visual cues are lost oftentimes through telemedicine. So it's really important for us to retrain folks into how to do healthcare. The other piece is think about our upcoming students, or excuse me, upcoming physicians, clinicians, PAs, nurses. And it's important that we look at all of our curriculums to assure that how to do medicine through virtual health. We need to be better at that. So we need to be training our future clinicians on how to navigate that. And then the other piece to that is we really need to be talking to CMS, the Center for Medicare, Medicaid Services, because we look at how are reimbursements taking place, because we want this type of healthcare to continue because we're reaching people that we were never ever able to reach before. So considering the technology, we talked about broadband and how that truly is a social determinant of health, but also think about the phone piece, declining cognitive situations. Or frankly, I don't know about you, but when I don't feel good, I'm not on my A game. So I'm not feeling so great either. But we have to think about even some of the kiosks that we set up, that we ask people to register in. We have to make it simple. And that goes back to digital literacy. We have to make it easy to understand so that folks don't have to consult someone else in order to fill out a simple form. So we got to think about that. But the other piece we need to think about, this is a great time for biotech firms to really look at what are the most efficient ways that they could, my patient Diane, that I could get a better assessment of her. So sure, I can have her stand on a scale and she can say, yes, I weigh 105 pounds and I've not gained any weight in the past month. But let's go beyond that. So how cool would it be to even have like a mouse and being able to put it on her chest and I can see an EKG? Or how interesting would it be for her to put some sort of speculum or something up to her eye so that I could see her retina? I mean, this is and I know there's plenty of biotech companies who've been working on this technology, but let me take you back to Star Trek because my family were big Trekkies and I love Star Trek still to this day. But when you think about what Bones did, if you remember, Bones was the physician and he took this little gadget that almost looked like a Bic lighter, and he would take it and drag it across his patient and he could immediately tell what was going on with his patient. And what's so fun is that, gosh, that's innovation. Why can't we do that? Wouldn't that be neat if something could gather that kind of information and then spit out, yes, this person has congestive heart failure. How beautiful would that be? So I'm looking forward to biotech firms doing some really cool stuff. I would encourage biotechies to go watch Star Trek and get some ideas from that. Much like in the trauma world, we learned so much from Korea and Vietnam in the field. I mean, that's how we learned beautiful trauma medicine. Let's do some cool things with this technology. So next slide, please. So let me talk to you, again, touch very gently on computer literacy. I can get by on a computer pretty well, but I have those that I consult who know some of the deep dive issues that I need to deal with. And, but again, keep in mind that as we mentioned about the social currency for teens, how important that is for their truly their milestones, their emotional milestones and their developmental milestones. That would be beautiful. And think about anything that you develop. Could your parent with cognitive decline navigate it by themselves? And if the answer is no, go back and do it again until we all are able to access that. So health literacy, I want to share with you a little bit about some special challenges. Health literacy is very near and dear to our hearts. If you go to the next page. And this is where our libraries across the nation can make a tremendous difference. And as it states here, what is health literacy? The degree to which individuals have the capacity to obtain, process, and understand basic health information. And there's lots of research out there that a lot of the materials that we're giving people post-discharge from the hospital, or think about the maternal infant mortality that's happening in the state of Texas, it's outrageous. But if you look at the material we're giving them to educate them for when they go home and how to take care of themselves and their babies, you will find that the literacy level is off the charts. And largely people just keep it in that sweet little folder that came from the hospital and they don't look at it again. And that places people at risk. So health literacy is also a social determinant of health for sure. So next slide, please. So as you can see, the statistics on here, they're terrible, frankly. And I will share personally that, you know, my family is from Germany. And so when my parents were here, my father spoke English beautifully. And so do a lot of our other immigrants speak English well, but don't assume that they can read English. So if you look at even malpractice and case studies, sometimes even the medication labels that we put on a medication bottle, we presume because Jessica's father speaks English well that he can read it. He can't, he cannot at all. So I think it behooves us all to better assess and understand what people around us can read and speak, because it could be very disparate and different. And it's not enough just to say, Miss Diane, can you read English? Yes, I can. It's not enough to do that. Make sure she really understands words like taking a tablet once a day, as opposed to taking a tablet once a day. Big difference, and can result in some catastrophic healthcare events. Next one, please. So this is a video I want to share with you, and it comes from the American Medical Association. I encourage you to watch the entire video. It'll move your soul, or at least it did mine. We have work to do. So if you would just take a moment and listen to this. Thank you, Diane.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is. That's
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
So that's...
I was sick a lot.
There you go. Thank you. So that's very sobering, and healthcare has to do better about what I consider to be just loving the individual right where they are and understanding where they are. That's a whole health concept, understanding people right where they are. And we have work to do for sure, all of us. But there's hope on the horizon. You all on this call, thank you from both Diane and me. This is the beginning of how we end these kinds of disparities. And I know Diane is a true champion for those sorts of things. Again, my colleague, Dan Burgard, I know all of us are working towards the resolution of these kinds of things, but health literacy is truly foundational to navigating this forward. So as you go forward, I just ask that think of atypical partnerships for the win. So before, geez, years ago, I never would have thought that I'd be partnering with a library to provide healthcare and all these amazing solutions. How beautiful is that? So I challenge you, what's the atypical partnership for tomorrow? Is it maybe something agriculture? You know, because there's lots of opportunity there. I mean, where can we go? So I hope you'll think out of the box from that. But again, I see every one of you as facilitators for both computer, digital, and health literacy improving in all of our communities. And then finally, the next slide is really just the future of medicine. It's just meeting people where they are, honoring their space, but truly taking the time to understand their worldview. How do they live? Do they even have a smartphone? Are they embarrassed to tell me they can't read my educational material? It's incumbent upon me to do that. And so it's also incumbent upon me to talk to biotech firms and let's get some really cool technology going so that we can further grow and make robust virtual health a very commonplace thing. So with that said, I think we are ready to pause, and this is where our wonderful host has asked that we stop and perhaps entertain some questions.
Thank you all for that wonderful presentation. We would now like to open it up for any questions. I did collect some while you all was presenting. The first question, they wanted to know where's the nearest hospital from the library?
The nearest hospital is just about 30 minutes from here.
And the next question, what precautions are in place to ensure compliance with HIPAA, including related to scheduling and tracking apps?
Thank you. Thank you for that question. And it's something that was first and foremost on our minds. So if you were to see a map of how one accesses this particular room in the Pottsboro Library, let me just try to give you a quick walkthrough. So they park behind, and there's a kiosk on the outside of this room. And, you know, they can begin there. Once they get into the room itself, no one else can see them. The door is closed. There's an entrance to the main library, but that door is absolutely closed. Within that room, both doors closed, they're by themselves. We have a secure access to that they interact with the provider that helps them with whatever the issue would be, and then they leave. So that's one piece, is that through the internet, it is a secure site. But the other piece is that when it comes to knowing when is that room going to be occupied, as Diane mentioned daily, she gets a report of you have an appointment slot here and here, but Diane does not know who it is. They don't know their name, and she certainly is not in the room unless she was invited in to say, hey, can you help me log on or what have you. But other than that, that is how we continue to preserve that. No records are kept at the Pottsboro Library, and through our HSC Health, everything there is secure and that interaction is secure.
Yeah, we're the conduit here at the library, and one issue that's come up that's been discussed is special for behavioral health appointments. with the stigma of that in a rural town, the library is a neutral place for someone to come. So they can come park at the library and actually feel like they have more privacy than going to park at a doctor's office for an appointment.
Someone wanted to know, do you ever have patients leave with their equipment?
Leave with their equipment?
Leave with your equipment like the thermometers or the blood pressure monitors or et cetera?
No, although, you know, in libraries, we kind of, a lot of that, we consider it would be a cost of doing business, just like our books and other things in our collection. If someone wanted to take something, you know, they could. It has not been an issue.
And do you have awareness of how many small and rural public libraries will be interested in offering this service? Have libraries been surveyed?
I believe that is in the works now. I know there are researchers who are working on this concept, and within Texas, Dr. Carol Perryman at TWU is working on talking to libraries about what would they need to feel comfortable doing this. And TLA is involved as well in getting this out to rural libraries across Texas. And I've been getting calls, I've gotten calls from state libraries all over the country. So there is a lot going on with this. The right now, I guess I can say this, is the National Library of Medicine, they're working on developing a community of practice. So all of the stakeholders who are interested in building on what all of us are doing can have a place that we can get together to share information.
And someone asks, are you aware of or have you used TEXLA, which is the Regional National Telehealth Resource Center created by HRSA for developing telehealth?
I have not, but if that's in the chat, I will check it out afterwards.
And someone asked, does patient education or community health department at nearest hospital provide any support?
Well, for what we've set up, they do not. This goes directly back to the HSC Health Science Center with our clinics. So it's directly to there, and we're located here in Fort Worth. So, but certainly I know that access that has been set up can also be used for individuals who want to access their own individual physicians and clinicians.
Jessica, I also wanted to mention, as part of this planning process, how you all looked for organizations that you could make referrals to, labs and that kind of thing.
She's right. We absolutely did do that because perhaps an individual may have needed some blood work or may have needed a particular radiology, an x-ray of some sort. So we had a team that scouted a peripheral area, and I believe it was within 60 minutes, and made a list of local referrals that our clinicians could utilize so that individuals wouldn't have to leave their community in order to get ongoing care. So yeah, that's always important, is to include that community assessment of what is available there to get those kinds of things done. So thank you for that, Diane.
And this will be our last question. Someone asked, what safety policies, precautions, or contingency plans that you need to implement when going live in case a patient experiences a medical emergency in the library, like chest pain or shortness of breath?
Well, I think that we both can answer that one. So first, know that, you know, we just, the policy for disinfecting that area, absolutely, with a fine tooth comb, we developed that policy, and I think it's beautifully done. And but I would love for Diane to talk about what's right across the street.
Yeah, again, small town, I can open the front door of the library and see the fire department. So I could just literally yell across like we need help. I realize that is not the situation in every library. We also have an emergency button at the front desk that calls the police department. So we're small enough that we have help nearby. The police station is a block away, fire department across the street.
Thank you all again for that wonderful presentation. It was a pleasure to have you all with us this morning. It's a couple of questions in the chat. If you all could address them, I think that would be great. And I can move forward with the demographics.
Okay, shall I stop sharing, Edward?
Yes, ma'am. We have just a few more items to cover before we end today's session. First, we're going to collect some demographic information for reporting purposes. Please follow the link Bailey Sterling has put into the chat box. It's completely anonymous, but it will help us report out the impact of these webinars. The first question asks for your zip code. The second is if you are attending as a group. If you are a solo attendee, please feel free to skip this question. If for whatever reason you are unable to access the poll, please enter your zip code into the chat box. When you are finished with these questions, please click the submit button to record your answers. When you are finished with the poll, you can close out the poll by clicking the X to the right of your screen. I'll give everyone a few seconds to do this. Thank you everyone for taking the time to give us that information. Again, if you want to close the polling, you can do so by clicking the X to the right of your screen. We would now like to ask everyone to complete the evaluation survey for today's webinar at the link provided on the screen. The survey will open automatically once the session has ended, and the link has also been put into the chat. If you would like to receive your certificate for continuing education credit, you will have the opportunity to download it at the end of the survey. Even if you do not want CE credit, we ask that you fill out the survey to give us valuable information about our webinars. Today's session was recorded and will be viewable online within the next week. Please check our archive webinars page for the video link. Last but not least, NLM has announced its 2021 to 2026 Regional Medical Library Cooperative Agreements, and I'm pleased to announce that the Gibson D. Lewis Library at the University of North Texas Health Science Center will serve as one of 7 regional medical libraries beginning May 1st, 2021. We will no longer be designated as the NNLM South Central Region. Instead, we will be known as Region 3. Over the next few weeks, we will be transitioning communication. If you're not already on our listserv and reside in one of the states listed above, Arkansas, Kansas, Louisiana, Missouri, Nebraska, Oklahoma, or Texas, I encourage you to follow us on Facebook and Twitter as we will be making transition announcements there. This will likely involve new social media accounts and mailing lists for you to follow or subscribe to keep abreast of our funding and educational opportunities. But not to worry, we will still continue this expert webinar series under a new name to be announced. We will begin again on the second Wednesday of June at 10 a.m. Central Time, as usual, while we transition all of our services. Thank you for joining us today, and we will see you soon.
Hi, everybody.
Bye, everybody.